Hello, I'm Dr. Butler. Today I will discuss changes in our skin during the menopausal stages and offer tips for caring for it. During the menopausal stages, declining estrogen and progesterone levels can cause dryness, thinning, loss of elasticity, wrinkles, pigmentation changes, acne, and slower healing. These shifts are driven by reduced collagen, altered oil production, and weaker skin barrier function. So let's get into it. The skin has three main layers: the epidermis, the dermis, and the hypodermis, which is the subcutaneous tissue. Each layer plays a unique role in protection, sensation, and regulation. The epidermis is the outer barrier that keeps bacteria and other germs from entering the body and bloodstream that causes infections. The dermis makes up 90% of our skin's thickness and provides strength and sensation. Lastly, the hypodermis cushions and insulates the body. It's its deepest layer, composed mainly of fat and connective tissues. The most striking transformation occurs in the dermis, where we observe the collagen crash, resulting in noticeable loss of firmness. Study shows that women lose up to 30% of the skin's collagen in the first 5 years after menopause, followed by a steady decline of 2% per year. When collagen declines, the skin becomes thinner, it starts to sag, and develops deeper wrinkles. Why is collagen important? I'm so glad you asked. Collagen is the most abundant protein in the body, making up about 30% of the total protein. It provides structure, strength, and elasticity to skin, bones, muscles, tendons, ligaments, and blood vessels. Collagen's main role is to provide structure, strength, and support throughout our body by helping new cells grow in the dermis layer, replacing dead skin cells, providing a protective covering for organs, giving structure, strength, and elasticity to our skin, and helping the blood to clot. Signs that our collagen levels have decreased are skin that are wrinkled or saggy, hollowing in and around the eyes and face, weak or aching muscles. We are stiffer, less flexible. We develop joint pain or osteoarthritis due to worn cartilage, loss of mobility, gastrointestinal problems, and problems with blood flow. To help slow the visible effects of skin aging, make sun protection a daily habit. Ultraviolet rays break down collagen that helps protect protein and keep the skin firm and resilient. Choose a broad spectrum sunscreen with SPF of at least 30 and pair it with physical protection such as a wide brim hat, ultraviolet blocking sunglasses, and the lightweight long sleeve clothing. For added defense, look for garments labeled with the ultraviolet protection factor. Steer clear of tanning beds, which accelerate collagen loss and skin damage. Support your skin from the inside out with a balanced Mediterranean-styled diet rich in vegetables, beans, whole grains, nuts, and fruit, complemented by moderate amounts of seafood, lean meats, poultry, dairy, and eggs. The next skin concern we have during the menopausal stages is severe dryness and loss of plumpness. Estrogen typically stimulates oil production and helps the skin to retain water. When estrogen levels drop, the skin barrier weakens, leading to less hydration and fewer natural oils. This results in the skin feeling tight, rough, itchy, or more sensitive. Fine cracks and flakiness may appear. There is also an increased risk of irritation, eczema, or rashes. Estrogen also supports collagen, elastin, and hyaluronic acid, all molecules that give the skin its firmness, bounce, and volume. Unfortunately, during the menopausal stages, collagen declines, hyaluronic acid production decreases, and the fat pads under the skin shrinks, especially in the face. The skin becomes thinner, more fragile, loses its structural fullness. As cheeks flatten and jawline lose their definition, the body's internal repair mechanisms begin to lag, slowing the healing process. Strategies to address these changes are using moisturizing products with ceramides, hyaluronic acids, glycerin, or squalane to restore hydration. For barrier repair, use gentle cleansers and fragrance-free creams to help rebuild the skin's protective layer. For collagen support, take peptides and vitamin C to stimulate collagen. Professional treatments such as microneedling and laser can help as well. We need to be sure we're consuming protein, vitamin C, zinc, and omega-3s to support collagen and hydration from within. Lifestyle options are use daily sunscreen, avoid smoking, and limit alcohol to preserve the skin's integrity. Next, let's look at the hormonal or menopausal acne, also considered the second puberty. This condition affects 12 to 22% of women in the menopausal stages, especially postmenopausal women. This can cause significant emotional distress and impact the quality of life, especially with those with darker skin due to scarring. While it may seem contradictory to experience both dry skin and acne simultaneously, this is a common issue during the menopausal stages. So, what's going on? While estrogen drops dramatically, androgens, a type of testosterone, declines much more slowly. This creates a relative imbalance, with testosterone becoming the dominant influence. Testosterone stimulates oil glands, specifically deep in the pores, and can increase inflammation and clog pores. Unlike teenage acne with the T-zone, menopausal acne typically appears deep, painful cysts or inflamed whiteheads along the jawline, chin, and neck. The exact cause of menopausal acne is not fully understood. However, several potential triggers and aggregating factors have been suggested, including exposure to ultraviolet radiation, stress, obesity, diet, smoking, sleep disorders, cosmetics, medication, excessive washing of the skin, possible resistance to specific acne bacteria, and endocrine deficiency diseases. So, what can we do to treat this? We need to use a combination therapy of gentle skincare, systematic anti-androgen therapy, and lifestyle management. Let's start with the gentle skincare. Now, mature skin with acne is different than adolescent skin with acne. Mature skin lacks ample levels of hormones that produce oil and is dry and easily irritated by some classic acne treatments. We should be washing our face with gentle cleansers only 1 to 2 times a day to protect the skin's barrier. Then apply non-comedogenic moisturizers. I know, right? What is non-comedogenic moisturizers? A non-comedogenic moisturizer is a skincare product specifically formulated not to clog pores, help reducing the risk of acne breakouts. Some examples are aloe vera, vitamin B3, glycerin, hyaluronic acids, dimethicone, and witch hazel. The term non-carcinogenic isn't strictly regulated by the FDA, so labels can be misleading. However, some non-carcinogenic oils that can be applied to the skin are grapeseed oil, sunflower oil, neem oil, sweet almond oil, and hemp seed oil. Next, we need to focus on systematic therapy, which is a broad term that refers to treatment or approaches that act on the whole body or the interconnected systems rather than targeting one localized area. Think of it as an inside approach. The best approach recommended by dermatologists is spironolactone, an anti-androgen. Spironolactone is an oil medication that blocks androgen receptors in the skin, helping to prevent both acne and excessive facial hair growth. Spironolactone also helps with unwanted hair on face, chest, back, or thighs, and it helps with hair loss. Lastly, lifestyle management strategies to help with menopausal acne are adequate sleep, stress reduction, and avoid smoking. The last topic I would like to discuss regarding skincare during the menopausal stages is thinning and bruising. This aspect often is overlooked, but is crucial to understand how these changes affect our skin and overall well-being. Because there is a sharp decline in estrogen, the hormonal shifts directly affect skin structure and resilience. The skin becomes thinner, more fragile, and it bruises more easily. A decline in estrogen triggers a drop in collagen production, leading to thinner, drier skin that lacks structure and volume. Elastin fibers also decline, reducing flexibility and making skin more prone to tearing and bruising from minor bumps. This is why many women notice their skin feeling paper thin during perimenopause and beyond. When our skin loses moisture, skin becomes dry. Dry skin is more fragile and is more likely to show damages even from minor impacts. Then the reduced oil production and slower wound healing further increases vulnerability. The skin's pH balance also changes due to fluctuating hormones. These changes can increase skin sensitivity and irritation or cause menopause rashes. As the skin thins, the tiny blood vessels, the capillaries under the surface loses cushion. Even light pressure can cause the capillaries to break, leading to subcutaneous bruising. This is why bruises may appear larger or darker than before. So, how can we tackle this challenge? We need to start with protecting and strengthening our skin barrier. As mentioned earlier, daily sunscreen with SPF 30 or higher. Use moisturizers with ceramides and hyaluronic acids or glycerin, and apply gentle cleansers. Make sure we are consuming protein, vitamin C, omega 3s, and phytoestrogens such as soy and flaxseed. Manage stress with yoga, breath work, or meditation. Lastly, maintain a consistent strength training routine. Now, what should we do when the bruising occurs? Apply a cold press, elevate the area if possible, and use arnica gel if tolerated. But what is arnica gel, right? Arnica gel is a topical product made from yellow mountain flower traditionally used to help reduce bruising, swelling, and soreness on the skin. It can be purchased online and in drugstores. Then lastly, caring for bruises, avoid massaging the area early on. Now, that's how we take care of our skin during the menopausal stages. I hope this information was helpful. I am building a community on YouTube and would love, 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 love if you shared and subscribe to the Newsome Fitness channel. Starting in January, all of my menopausal videos will be posted on the YouTube channel. One more thing, if you're in the local area, so if you're in San Antonio, don't forget about the sound bath at Newsome Fitness on January 10th at noon. Until then, have a blessed one. I'll see you next week, and I hope you have a very Merry Christmas. Bye-bye.